Hi folks, this is Dr. Burke Mays with Pathways Integrative Health Center. Today I'm here talking with you about how low thyroid function affects blood sugar levels. And that's actually a bigger deal than it seems, because right now it's estimated in America about 105 million people are dealing with either type 2 diabetes or we call dysglycemia. And what that looks like is if there's a common test that can be run called HbA1c that tells us the average of your blood sugar over the past 90 to 120 days. And if that value is above 5.7, there's a problem going on. You're not utilizing, metabolizing sugar properly. What happens is there's a hormone release called insulin. When you eat or when the sugar in your bloodstream, insulin is released by your pancreas, and that pushes sugar into your cells, so now your cells can work and make energy. And that's not happening, that's a problem. And also too, there's a condition called insulin resistance where your cells don't recognize the presence of insulin, and then blood sugar goes up, and your cells also, if they're not getting the sugar into the cells, your cells don't work. And the impact of that is actually really huge. You know, when I was in school 20 years ago, it was estimated that about 20 to 25% of the healthcare dollar went to support diabetes and diabetes-related issues. And I saw in 2015 that estimate now is up as high as 45 to 50% of our healthcare dollar is spent on issues related to blood sugar. You know, that's not only diabetes, but that's related also kidney issues, liver issues, high cholesterol, high blood pressure, cardiac disease, a whole long host of things are related back to poor blood sugar control. And how the thyroid relates to that is when your thyroid's not making the hormones, or the thyroid hormones aren't working. You know, what happens then is that slows the uptake of glucose into your cells. It blocks the action of insulin. So now the sugar's not getting into your cells, so now it's seen out in your bloodstream. And one of the things that your body does in response to that is it stores the sugar someplace else. And a big storage spot is triglycerides. So you almost always see somebody who's dealing with blood sugar control issues that their cholesterol starts to go up. The total cholesterol, I'm sorry. Also, when the thyroid hormone function is poor, it slows the absorption of glucose from your digestive system into your bloodstream. So that's a problem. It also slows your response to insulin, that hormone whose job is to push glucose into your cells. It slows or blocks that effect. So now two things happen. You're getting higher blood sugar in your blood, and you're also getting less sugar into your cells for your cells to work. And then lastly, it slows the clearance of insulin. And that's a big deal because insulin's supposed to be used, or then your body gets rid of it. If it accumulates, insulin is inflammatory. And inflammatory is the root of a lot of health conditions, anywhere from brain fog to arthritis to chronic pain. We call meta-inflammation. By that I mean, you know, if you sprain your finger, you get local inflammation. That's an appropriate response. Meta-inflammation is when your whole body becomes inflamed. It has a profound effect on our health, affecting everything from brain function to hormone function to pain sensation to a lot of different things. Suffice to say, in a short version, bad things like inflamed environments. So we want to reduce inflammation in our bodies. And overall, when a person has that poor blood sugar control, we see the fatigue, we see the weight gain. It also affects cortisol function. That's another lecture I'm going to do. Cortisol is a stress hormone. Cortisol breaks down muscle tissue. It affects brain function, blocks hormones. So we want to keep cortisol low and insulin under control and blood sugar balance for a shot at having good health and well-being. You know, because really is thyroid function affects blood sugar levels, and blood sugar levels affect thyroid function, vice versa. So the best thing is we want to get those balanced so you can actually have a shot at your body working the way it should normally. I hope this video is of value to you. Stay tuned for other videos, and be healthy, be happy.